What is COVID-19? COVID-19, short for Coronavirus Disease 2019, is an infectious disease caused by a novel coronavirus known as SARS-CoV-2. It was first identified in December 2019 in the city of Wuhan, Hubei Province, China. COVID-19 has since become a global pandemic, affecting countries worldwide. The virus primarily spreads through respiratory droplets when an infected person coughs, sneezes, talks, or breathes. It can also spread by touching surfaces or objects contaminated with the virus and then touching the face, specifically the mouth, nose, or eyes. COVID-19 can cause a range of symptoms, from mild to severe, and some individuals may remain asymptomatic. Common symptoms include fever, cough, fatigue, body aches, sore throat, loss of taste or smell. Severe cases may lead to pneumonia, acute respiratory distress syndrome, ARDS, organ failure, and, in some instances, death. To prevent the spread of COVID-19, public health measures such as wearing masks, practicing physical distancing, frequent hand hygiene, and avoiding large gatherings have been implemented. Vaccines against COVID-19 have been developed and are being administered worldwide to provide immunity and reduce the severity of the disease. It's important to stay updated with information from trusted sources such as the World Health Organization, WHO, and the Centers for Disease Control and Prevention, CDC, to understand the current state of the pandemic and the recommended preventive measures. What are the impacts of COVID-19? COVID-19 has had a significant impact on various aspects of society, leading to both immediate and long-term effects. Here are some notable effects of COVID-19. 1. Health impact. COVID-19 has caused millions of infections and deaths worldwide. It has overwhelmed healthcare systems, especially during the peak of the pandemic, leading to challenges in providing adequate care for all patients. Long-term health effects, known as long COVID, have also been reported, with some individuals experiencing persistent symptoms even after recovering from the acute illness. 2. Economic impact. The pandemic has had a severe economic impact globally. Lockdowns, travel restrictions, and business closures have disrupted supply chains, led to widespread job losses, and caused economic recessions in many countries. 3. Education disruption. School closures and the shift to remote learning have disrupted education systems worldwide. Many students have faced challenges with access to technology, online learning resources, and the loss of in-person interaction and support. The impact on learning outcomes and educational inequalities is a concern. 4. Mental health impact. The pandemic has taken a toll on mental health. Social isolation, fear, grief, and uncertainty have contributed to increased rates of anxiety, depression, and other mental health conditions. Access to mental health services and support has become crucial during this time. 5. Social and cultural impact. COVID-19 has changed social dynamics and behaviors. Social distancing measures and restrictions on gatherings have impacted social interactions, events, and celebrations. 6. Travel and tourism. International and domestic travel restrictions, along with concerns about the virus, have severely impacted the travel and tourism industry. Airlines, hotels, restaurants, and other businesses reliant on tourism have experienced significant losses. 7. Scientific advancements. The pandemic has led to unprecedented scientific collaboration and advancements. Rapid development and distribution of vaccines, improvements in testing and diagnostic methods, and increased understanding of the virus have been notable outcomes of the global scientific response. It's important to note that the effects of COVID-19 can vary across regions and communities. Additionally, efforts to mitigate the impact, such as vaccination campaigns and the development of public health strategies, continue to evolve as our understanding of the virus progresses. What are the treatments of COVID-19? The treatment of COVID-19 depends on the severity of the illness and the specific symptoms experienced by the patient. Here are some key approaches and treatments used in the management of COVID-19. 1. Supportive care. Many individuals with mild to moderate symptoms can recover at home with self-care measures. These include getting plenty of rest, staying hydrated, and taking over-the-counter pain and fever medications, example, acetaminophen, as directed by a healthcare professional. 2. Hospitalization. Severe cases of COVID-19 may require hospitalization, especially if the patient experiences difficulty breathing or requires supplemental oxygen. Hospitalized patients receive close monitoring, oxygen therapy, intravenous fluids, and other supportive measures. 3. Oxygen therapy. For patients with low oxygen levels, supplemental oxygen therapy may be provided through devices such as nasal cannulas, face masks, or high-flow oxygen systems. 4. Antiviral medications. Certain antiviral drugs may be prescribed to hospitalized patients with severe COVID-19. These medications, such as remdesivir, work by inhibiting the replication of the virus. 5. Anti-inflammatory medications. In some cases, the immune response to COVID-19 can lead to an excessive inflammatory reaction known as a cytokine storm. To counteract this, corticosteroids like dexamethasone may be administered to reduce inflammation and prevent organ damage. 6. Monoclonal antibodies. Monoclonal antibody therapies, such as bamlanivimab and casirivimab/imdevimab, may be used to treat certain high-risk.
7. Vaccination. COVID-19 vaccines have been developed and authorized for emergency use to prevent infection and reduce the severity of illness. Vaccination plays a crucial role in controlling the spread of the virus and minimizing the impact of the disease. It's important to note that treatment protocols may vary based on the evolving scientific understanding of the virus and specific guidelines provided by health authorities. Medical professionals are best equipped to determine the appropriate treatment approach for individuals with COVID-19 based on their clinical condition. What are the precautions of COVID-19? To help prevent the spread of COVID-19, it is important to follow recommended precautions and guidelines. Here are some key precautions to take.
1. Vaccination. Get vaccinated against COVID-19 as soon as eligible. Vaccines have been shown to be highly effective in preventing severe illness, hospitalization, and death. 2. Face masks. Wear a mask in public settings, especially indoors or in crowded areas, where maintaining physical distance may be challenging. Use masks that cover both the nose and mouth and follow local guidelines on mask usage. 3. Hand hygiene. Wash your hands frequently with soap and water for at least 20 seconds. If soap and water are not available, use hand sanitizer with at least 60% alcohol content. 4. Physical distancing. Maintain a distance of at least 6 feet, 2 meters, from others who are not from your household, especially in crowded areas. Avoid close contact, such as hugging or shaking hands, with people outside your household. 5. Respiratory etiquette. Cover your mouth and nose with a tissue or your elbow when coughing or sneezing. Dispose of used tissues properly and wash your hands immediately afterward. 6. Ventilation. Ensure good ventilation in indoor spaces by opening windows or using air purifiers. Fresh air circulation helps reduce the concentration of viral particles. 7. Avoid crowded places. Minimize or avoid gatherings, particularly in enclosed spaces, where social distancing may be challenging. Follow local guidelines and restrictions on gathering sizes. 8. Stay home when sick. If you experience any symptoms of COVID-19, such as fever, cough, or difficulty breathing, stay home and seek medical advice. Follow the guidance of healthcare professionals regarding testing, self-isolation, and treatment. Thank you.